All right, so the first thing I wanted to start with was basically what privacy means, because sometimes there's actually a little bit of misunderstanding about exactly what that is. So it's basically a person's legal right to control access to their personal information or their personal health information. So people do have a legislated right to they have something to say about who gets to see their stuff, essentially. And we have two pieces of privacy legislation in the province of New Brunswick. We've got the Right to Information and Protection of Privacy Act, and you might hear that referred to as our PHIPAA. And then we've got the Personal Health Information Privacy and Access Act, or the PHIPAA, which is the legislation that I'm focusing on for today. So this legislation has been around now for a while. It came into force in 2010. The Ombudsman has oversight over the privacy legislation. The purpose of this act is to protect the confidentiality of health information and also the privacy of the individual. And it creates a number of rules about the collection, use, and disclosure, and also the retention and destruction of personal health information and how that is to be done. It does put some accountability on the people who have access to personal health information. It provides requirements around safeguarding the security of personal health information. It gives individuals a legal right to access their own health information, and it also permits individuals to make requests for corrections to their personal health information if they've seen an error. So consent is really the major theme, I would say, that runs through virtually all privacy legislation, not just Canadian legislation, but really it's a universal principle. And 10 interrelated privacy principles form the basis of all privacy laws in Canada. Those 10 privacy principles come from the Canadian Standards Association Model Code for the Protection of Personal Information. And one of those 10 principles is consent. And the concept of consent is directly related to the right to privacy. Privacy is respected if patients or people have an opportunity to exercise control over their information by requiring consent to accessing their information or using their information or disclosing it. So free and informed consent lies at the heart of ethical research involving human subjects, and it also lies at the heart of privacy legislation. And this would encompass a process that begins with the initial contact with a patient, and it carries through all the way to the end of the involvement of research participants in a project. And the process of free and informed consent refers to the dialogue, information sharing, and general process through which prospective participants elect to participate in the research in the first place. So the REB will only approve research and allow it to begin if the participant has been given the opportunity to freely and voluntarily consent to participate in the research, unless it's been determined that it's unreasonable or not practical to obtain consent. And they also want to know that the consent has been obtained and reaffirmed as necessary as maintained throughout their participation in the research project. Informed consent process has to comply with the requirements of the Tri-Council Policy Statement Section 3, which is the section that deals with the consent process, and it also needs to comply with the privacy legislation. So can a researcher access health information for research without consent? They can, but they can only do that if the Research Ethics Board agrees with the researcher's justification as to why consent is not required or why it would not be practical to obtain consent. So when would it be not practical to get consent? So some of the justifications might include the fact that the size of the population that you're looking at is simply too large and it would be too cumbersome to go out and try to get a consent from a large number of people. Another justification could be that the proportion of participants is likely to have relocated or perhaps died since the data was collected, or there may be a lack of existing relationship between the researcher and the participants such that there could be a potential for introducing bias, or the additional financial, material, or human resources needed to get consent would impose a hardship or a burden on the researchers, and it would result in the research not being done at all. So I wanted to note that the Research Services Group or the Research Ethics Board will absolutely guide you through the process if you're looking for a waiver of consent on a project. So you need to be very careful because express consent may be required to recruit participants into a project or using their personal health information to identify and contact potential study participants. It may be required for determining study feasibility. Sometimes researchers want to review personal health information to decide if a study is of clinical interest or whether the patient population is sufficient. And it might be required for conducting non-interventional studies, for example, chart reviews, extracting, identifying, or non-identifying data from health records, databases, etc. So I think this is an important point to be made because we have had instances where there have been requests, or we have found out after the fact that health information has been accessed to look for contact information for potential study participants, and that going in and doing that would not be appropriate without taking the appropriate steps. So in terms of accountability, and I spoke about that at the very beginning, I said that the legislation places accountability on employees of Horizon and people who are considered custodians under the Act. And so researchers and the research ethics boards all share a responsibility for protecting participant confidentiality and privacy. Researchers must include safeguards for participant information, and they have to anticipate any reasonably foreseeable disclosure requirements. And the REB is responsible to review the ethical acceptability of the research protocol, and they have to take into consideration any privacy and confidentiality commitments. So when you look at the Tri-Council Policy Statement, Chapter 5, which deals with privacy and confidentiality, there are some key points. So researchers and REBs are expected to identify and minimize privacy risks at the outset. That's a privacy by design approach. In addition to following guidance provided by the Tri-Council Policy Statement, researchers are responsible for compliance with all of the legal and regulatory requirements with respect to the protection of privacy and consent for the collection, use, or disclosure of the information about the participants. And the easiest way to protect participants is obviously through the collection and use of de-identified data. The legislation does allow the use of de-identified data for any reason, including research, without consent, but it has to be subject to any risks of re-identification. And so when we're talking about de-identified data, there's lots of considerations. I have volumes of books on my own bookshelf dealing with de-identification and the process of de-identification. And it's important to realize that what appears to be de-identified data may in fact be quite identifiable. So you may not use patient names, but sometimes even through a postal code, depending on the situation, it may actually be possible to identify a person. If you're talking about an individual, for example, who lives in a small community, who has some kind of a facial disfiguration, for example, without the name, people would know exactly who it is that you're talking about. So if there's any questions about whether things are identifiable or not, it's better to seek advice. Another key point is that when data for research is identifiable data, there's an ethical duty of confidentiality and the use of appropriate measures to safeguard the information. More stringent protections are required in research when there's identifiable information, and research services must be consulted when you are uncertain about whether data is or is not identifiable. In Horizon, for research projects, it is a requirement as a preliminary step in any event to reach out to research services. Researchers must advise participants of any reasonably foreseeable disclosure requirements. And this is a very important aspect of the consent process because in order for consent to be valid, it needs to be a knowledgeable consent. They need to understand why you're collecting their information and who it may be shared with. If personal information is gathered for research and is intended to be shared with others, it's very important that participants understand that from the get-go. If personal information collected for a research project is going to be used later for a completely different purpose, reconsenting is required unless the legislation permits a secondary use without consent. Researchers must provide details to the Research Ethics Board regarding their proposed measures for safeguarding the full life cycle of the information, its collection, its use, dissemination, retention, and/or disposal, and safeguards should include adequate administrative, physical, and technical measures. So administrative safeguards are things like policies and procedures, people having taken their privacy education when required, the signing of the confidentiality declaration, that sort of thing. Physical safeguards are things like locked cabinets, having swipe access to areas where health information is stored or kept. And technical measures are things like password protection, encryption, and that sort of thing. So you need to make sure that you've covered off all of those areas when you're talking about safeguards. And in addition to following the Tri-Council policy statement, compliance with the privacy legislation is required, and also compliance with Horizon policies. In some instances, the legislation requires that a privacy impact assessment be done, and researchers need to address whether a PIA is or is not required, and they can do that by reaching out to research services. So what is a privacy impact assessment? It is simply a risk assessment tool. It's documenting the process from beginning to end. It tells a story from a privacy perspective about a project, program, or service, technology, or information system. And what it does is it identifies privacy risks, and it takes steps throughout the process to minimize or eliminate those risks. So a privacy impact assessment is a legal requirement under specific circumstances, as noted in the Personal Health Information Privacy and Access Act. So you want to make sure that that's done, because in the event of a privacy breach, if there was a requirement for a PIA and it wasn't done, this is going to get us into trouble with the Ombuds Office, who has oversight over the privacy legislation. When there's a breach, one of the first things the Ombuds Office will ask for is to see our privacy impact assessment if one was necessary. So a privacy impact assessment ensures that the project, program, service, technology, or information system complies with all of the legislative requirements or policy and organizational requirements for information protection. It also reflects the public's expectations regarding privacy of their information. It addresses concerns key stakeholders may have regarding ensuring the privacy information that will be collected, used, and disclosed. And it can be supported by oversight bodies, as I mentioned, such as the Ombuds Office or even the Canadian Institutes of Health Research, etc. And it builds privacy protections into the design from the outset of the project. So I use the term privacy by design. It's making sure that privacy protections are built in from the start, as opposed to realizing you have a problem later and trying to backtrack and put those protections in. I oftentimes use the analogy of you're building a building. It's much easier to put an elevator in as you're building, as opposed to realizing later that you'd like an elevator and having to go back and deconstruct and put that in. So Section 3 of the Personal Health Information Privacy and Access Act indicates that approval can only be given for a research project if the Research Ethics Board has determined that the research is of sufficient importance to outweigh the intrusion into privacy that would result from the disclosure of personal health information, and also that the research project cannot reasonably be accomplished unless personal health information is provided in a form that identifies individuals. It also says that the individuals to whom the information relates have to have consented to its use and disclosure, or it has to fit into that category where it's been justified that it's not practical for the person doing the research to get the consent, and it's been approved by the Research Ethics Board. The research project must contain reasonable safeguards to protect the privacy and security of the information, and it also has to have procedures established to destroy the information or de-identify the information at the earliest opportunity, consistent with the purposes of the Act. So if for the purpose, or of the project rather, and so if information needs to be collected and kept for a certain period of time in order to accomplish the purpose of the research project, there needs to be some thought given to when it would be appropriate to destroy that information when it's no longer required for that purpose. And that is another reason for the privacy impact assessment, because it will take note of that and ask the questions around retention and how long it's necessary to keep the information after the purposes have been accomplished. An approval of a research project by the REB is conditional upon the person proposing the project entering into an agreement with the custodian in accordance with the regulations that go with PHIPAA. There must be an agreement not to publish the personal health information requested in a form that could be expected to identify the individuals, to use the personal health information requested solely for the purpose of the approved research project and not for any other purpose, and to ensure that the research project complies with the safeguards and procedures described in paragraphs 43 of PHIPAA. So research services must be consulted to determine if a written agreement is required and to assist in the drafting and or the review of that agreement. Generally, we refer to this as a data sharing agreement, and research services has all kinds of templates available, and they are happy to assist with this if you need an agreement. So the other area I wanted to speak about is consent to access personal health information for recruitment purposes. So I spoke earlier about the fact that this may require consent. So what you can do if you need to access personal health information to recruit people to participate in the project, there are some options. So someone involved in the patient's care, for example, a physician, could obtain patient consent to have their health record reviewed by a research team for eligibility screening only. So the physician would be letting them know that there's a interest in a research project. They are looking for possible participants, and he would get their consent to have the research team look at it to see if they would be good participants. This can be case by case, or a list of patients could be generated by caregivers for the research team members in that case. Patient's consent is obtained for research services, or for the research team member rather, to approach the patient for consent to access personal health information. Verbal consent is acceptable, but in the case of verbal consent, it's still express consent, and even if a form is not completed or signed, it would need to be documented on the patient's health record that they've been asked the question and that they have said yes. Documented consent using a consent template for access to PHI for recruitment purposes only has been used. These have been implemented at a team, departmental, or divisional level. That's another option for consent. These consents and processes must be reviewed and endorsed by the REB and research services. A researcher can also submit a request for waiver to consent, as we've discussed. So then there's also the consent for determining the feasibility of a study. So in this case, you would submit the request to the REB. You may want to consult with research services as a first step. The REB will be the group that determines if access without consent will be permitted to determine whether or not the study is feasible. If certain parameters are adhered to, the REB may approve this access without consent, but this would have to be determined on a case-by-case basis. So then we need to talk about consent for non-interventional research. Some of the options, you would have the same considerations here as would apply to clinical trials. Consent would be required unless a waiver is issued. It might be easier to justify why a waiver should be issued. For example, if you've got 3,000 reports of surgical procedures on patients with hip fractures and there's a 3-month collection period of data. For this type of research, the first consideration should always be de-identification of data and whether or not the data can be identified and whether it's useful to you in a de-identified state. So we need to talk a little bit about identified versus de-identified. So directly identifying information would be things such as a name or Medicare number. Indirectly identifying information could be using a date of birth, a hospital admission date, and a postal code. And then there's coded information where a custodian holds the key, and in that case, it's de-identified, and there's very low risk that it can be linked with a patient without having that code. So what should you consider? You should identify technical solutions that would maximize data security. Consider, again, the potential for re-identification. Use the least amount of information necessary to answer research questions and in a manner that ensures confidentiality. So one of the other themes that runs throughout privacy legislation is the rule of minimums. And it always says that you want to try to use the minimum, absolute minimum amount of information necessary to accomplish your purpose. So when you're looking at the purpose of your research, you want to consider whether or not, again, de-identified information would work for that purpose, or is there actually a requirement that the information be identifiable? And if so, what solutions can you put into place to maximize the security of that data? Always ask yourself if the research can be done with de-identified data. If not, the researcher needs a plan to obtain consent prior to access if that's necessary. If it's not, and there's sufficient evidence to justify that obtaining consent is not practical, then you need to get a request for waiver to consent completed. REB approvals and authorizations. So it's important to note that a waiver of consent to access personal information is not a get out of jail free card. Consent waivers are study specific and you cannot transfer that to another study. You're still expected to have appropriate authorization from the custodian of the data, so that would be Horizon. REB approval or authorization does not equate to permission to access specific systems containing personal health information. And if you need access to systems containing personal health information, this is a separate process and you have to connect with research services. It would be research services that would make the arrangements for your access to the system if that's appropriate.